Hello, it's Michelle here, and this is a presentation on, well, a series of presentations on the anatomy of the lower limb, arteries and veins. And so what we're going to cover is the lower limb arteries, and they will extend from the abdominal aorta down to the ankle. And then we cover those first because the veins will basically, well, the deep veins will follow the arteries. So then after that, we will cover the deep veins, and we will cover from the IVC, the inferior vena cava, down to about our ankle. And then we're going to cover what we call the superficial veins, and that's quite quick. And we'll just follow them in the leg. And then if we get a chance, we'll go onto the lower limb nerves. And basically, we're looking at neurovascular bundles, which is veins, arteries, and nerves. Sometimes there's not nerves that follow the veins and arteries. Sometimes there is. Okay, so we're going to start on the arteries, and I'll stop this if it's going too long, and we'll cut it down into segments. So the arteries, A for away. Arteries take blood away from the heart, and so it's going to take it from the abdominal aorta, which we're going to look at inferior to the diaphragm, and taking it down through the abdomen and pelvis into the groin, into the medial parts of our thighs, and then the posterior parts of our knees, and then into our leg, where we have sort of three main arteries that we follow. We break the leg up into different sections. So we've got up here the aorto-iliac, which covers the aorta down to the iliac vessels, and then what we call the thigh and the knee area, so the femoral-popliteal vessels, which go from sort of hip down to knee, and then what we call the crural or the tibio-pedal. Tibio refers to the region of the tibia, and pedal refers to your foot. We do this because when we examine a patient sonographically for PAD, peripheral arterial disease, meaning that there could be blocking of the blood getting down to the distal part of the leg or the foot, we divide the arteries into these sort of segments. So it's just interesting to know that that's the way it's divided up. So we're going to start with our abdominal aorta. Now remember, our abdominal aorta is a continuation of it comes out of our left ventricle, then we have our aortic root, then we have our ascending aorta, then the arch of our aorta, and then our descending thoracic aorta, and then once it's in the abdominal cavity, well, there's different ways we can call it abdominal aorta, but in the abdomen, we generally refer to it as the abdominal aorta, which is this bit. And then it comes and bifurcates at about belly button level into our iliacs here, our common iliacs. So the aorta sits right anterior to the spine, and this is a picture of the diaphragm looking up. And you can see the IVC pierces the diaphragm a bit more anteriorly than the aorta. So the IVC is going to sit a little bit more anteriorly and a bit more to the patient's right than the aorta, which is going to sit in front of the patient's spine. Here's our left ventricle, and you see our left ventricular outflow tract, our aortic root, our coronary arteries that come off it, then our ascending aorta, arch of the aorta with our head and neck vessels, and then the descending thoracic aorta, then abdominal aorta. So I've highlighted the arteries that are important to know, and it looks a bit scary, but it's actually not. So we're just going to break it down. We have our abdominal aorta here, which bifurcates at our belly button level. So if our belly button sits in the right spot, about there is where our aortic comes down, and then it's going to divide and go out either side into our pelvis, into our common iliac arteries, our right and left common iliac arteries. It gives off an internal iliac artery, which runs sort of more posteriorly and medially, I suppose, and then we have our external iliac artery, and then that travels down to about our groin crease level, where we have our common femoral artery, which is very short, and then our common femoral artery divides, or we use the term bifurcates, as you can see here, into a deep and just what we call a femoral branch. So we used to call this femoral artery the superficial femoral artery, but it got very confusing because it's actually what we consider a deep artery. So we have the profunda femoral artery. Profunda is an old term that means deep. So our profunda femoral artery and then our femoral artery. And our femoral artery is quite long and it sits in the medial aspect of our thigh. And it runs a lot through what we call our adductor canal. And then the inferior portion of our adductor canal, when it comes out of that, it becomes and sits more in the posterior aspect of our knee. And then that becomes our popliteal artery. Then our popliteal artery travels down past our knee joint and a bit below that. And then it gives off a branch called our anterior tibial artery, which, as its name suggests, is going to go and sit on the sort of anterolateral aspect of the tibia. And then we have a common trunk called our tibio-peroneal trunk. And that sounds like a long name, but it's actually quite easy because it gives rise to some tibial vessels and peroneal vessels. Those tibial vessels are posterior tibial vessels, and then the peroneal vessels, peroneal is another word for fibula, so you may see this called the fibular artery, and it sits over laterally in your leg near the fibula. So I've done this little drawing which really simplifies the arteries and as we follow them down. And you can see if we do a contrast sort of enhanced CT angiogram here, you can see the aorta, the common iliac artery, the internal and the external iliac artery. That's our groin crease. Inguinal and groin sort of mean the same thing there. Common femoral artery, and then it gives off our deep or profunda femoral artery. And then this, you can see it's still called superficial femoral here, but it's really what we call now our femoral artery. Superficial femoral is the old term. It runs on the inside. See how it's running on the inside part of our thigh? We don't have any arteries that sit on the lateral part of our thigh. So what you're seeing here is what we're seeing here. Is our internal and external iliac artery. This is our inguinal ligament here, so our groin level, groin crease level, and then we'll have a little bit here called our common femoral artery, and then this is our femoral artery all through here. If we look at a CT scan, we've got our liver over here on the patient's right and our spleen over here. We've got our abdominal aorta here and the crus of the diaphragm that sits around it. And then our IVC sits out here. It sits over more to the patient's right. And when we do an ultrasound, we can see the aorta, which sits anterior to the vertebrae, and then our IVC, which will sit a little bit more to the patient's right. We can do a long axis sonographic view of the aorta. We can see it, it takes blood away from the heart, so this is towards the head and the feet, so it's taking blood down this way, but we get a nice view of it, and then the vertebrae or the vertebral column will be sitting posterior to it here. When it comes down to the umbilicus term, is the term we use, the more official term rather than belly button, is where it's going to bifurcate. So a bifurcation of an artery is where it splits into two, which we're going to travel distally down towards distal structure. So in our lower limb, our distal structure will be our foot. So our aorta bifurcates into right and left common iliac arteries. It's common here because down here further we're going to have an external and an internal. So this is called common iliac arteries. So you can see the blood comes out here, down here, and then either travels down to the right leg or the left leg via these right and left common iliac arteries. So if we took our ultrasound probe down past the belly button level, above the belly button level we would see a single aorta, and below the belly button level we've seen it bifurcate into our right and left common iliac arteries. That's just past the bifurcation, and we can still see still sitting anterior to our vertebrae. So this is a transverse sonographic view. So this view here would be taken right at about this level here. You can see it here on the CT scan. This is the vertebrae here, and you can see your right and left common iliac arteries. There's our psoas muscles in there. Our common iliac arteries are going to then travel down, and then they're going to bifurcate into a internal iliac artery and then at the external iliac artery. So the internal iliac arteries, you can see they're more medially located. And then the external iliac, think they're more external. They're going to become more superficial as well, but they're also going to sit more laterally. And so that's how we tell the difference between our internal and our external. Now, I don't know if you remember, but our internal iliac arteries give rise to a whole lot of deeper sort of structures and give off a whole lot of other little vessels. We're not worried about that too much now. The main thing we need to know at the moment is the aorta, the common iliac, the internal iliac, and the external iliac. This is all above this structure, which is in our inguinal ligament and above our groin crease. So let's follow them down in a CT. So these are transverse or axial CT scans. That this is more superior, and they're moving more inferiorly as we move through the sacrum here. So we can see our psoas muscles here. We can sort of see our right common iliac artery, which is just sort of bifurcating, and our left common iliac artery, which is bifurcated into our internal and our left external iliac arteries. That's our internal and external and external iliac arteries. So this is our right, I hope I said that right, right external and right internal, left external and left internal iliac arteries. I hope I'm not confusing you there. So here's our right external iliac artery, and I think this is here is our, that could be a branch here. This is our right internal iliac artery. So you can sort of see the external are traveling, they go a little bit more laterally, but they're going to come more superficial as we travel down in the pelvis here. And then they eventually travel to, this is them a bit further down, this is at the acetabulum or hip level, and we've got the bladder sitting here, and we can see our right and our left external iliac artery. This is just above the level of the groin. So at the groin level, they become quite anterior and superficial. So once we hit this inguinal ligament, which really corresponds to our groin crease level, it finishes being the external iliac artery, and it becomes what we call the common femoral artery. So the common femoral artery are these brighter structures here, which are brighter because they're attenuating more of the x-rays on the CT because they've got iodine in them. And it's important to note that our femoral arteries, our common femoral arteries, are sitting here, and these things here are our common femoral veins. So the veins sit more medial to the artery. So where are we? This is the region of our common femoral artery. Our inguinal ligament would have run through here, and it extends from our inguinal ligament down to where it's going to bifurcate into a deep or profunda femoral artery, and just our femoral artery here. This is a cross-section of that inguinal ligament here, so we're just a bit inferior to it, so we would probably call this our common femoral vein and our common femoral artery here. Here we've got the femoral nerve. So this is important. This is lateral and this is medial, and it's important to notice that the femoral vein is more medial and the femoral artery sits lateral relative to the vein. The nerve actually sits the most lateral, and there's a bit of an acronym that we can use is naval, NAVL, because our lymphatics actually sit more medially. So NAV and lymphatics. This here is showing our femoral canal, which is in a normal patient just completely compressed, but occasionally someone can have a bit of their abdominal contents go through there, and that causes what we call femoral hernia. So a hernia is where tissue is moving through an area where it's not supposed to. So it's not supposed to be coming from our abdomen and going down our leg, and that's the way a femoral hernia would run down that way through this femoral canal, which is not really perceivable when it's in its normal state. So here I've put the acronym on you, NAVL, so femoral nerve, femoral artery, femoral vein, and femoral lymphatics. That green structure is the lymph vessels, as you can see. So that navel runs from lateral to medial. Another acronym that gets used is NAVY, so nerve, artery, vein, because we don't usually care too much about the lymphatics, and NAVY, and Y stands for Y fronts, meaning your gonad sort of area in the male sits more medial. So if Navy helps you remember it, remember Navy. This is just a picture showing that femoral canal that we don't normally see. So this is lateral and this is medial, and this is a bit of abdominal contents in the bowel. It's moving down the thigh in the region where a femoral hernia can sit. And you can sometimes get a little lump that sits just there. When we look at this common femoral artery in cross-section sonographically, we're going to put the probe across in our groin area just here, and the probe's only this big, so we only see with a little window and we get this image. And so sometimes it's important that we can pick out what's the vein and the artery, and we need to know what's lateral and medial. So I've identified them here. The femoral vein will always sit more medial to the femoral artery. So we know this is lateral and this is medial. So the nerve would be sitting out here and that little femoral canal would sit in here. So it's important that the common femoral artery always sits lateral relative to the femoral vein. Now we have a femoral artery and femoral vein, and then we have the profunda femoral artery, which is going deep. So you can sort of see this is superficial here and this is deep down to the femur. So you can see the femoral artery is superficial relative to this profunda, which means deep femoral artery. So if you can't remember the word profunda femoral artery, remember deep femoral artery. And so it just sits deep relative to the femoral artery. And this is where it's dividing here. That's our femoral artery and that's our profunda femoral artery. So this is just after the bifurcation of common femoral artery. It's going down further away from the hip level. We're at the level of the pubic bones here. And we can see we've only got the common femoral artery singular on this side. It hasn't bifurcated on the left, but it's certainly bifurcated on the right. And that could be the patient's not quite, and you can see that with the hips, they're not quite sitting straight in the CT scanner. So sonographically, this is a long axis view, and this is our common femoral artery, which this is the head here and this is the feet down here. So the blood's coming down this way, and it can either go deep down into the profunda femoral artery, or it can go more superficial just into what we call the femoral artery. Remember, we don't call it the superficial femoral artery anymore. That's an older term. This is with some coloured Doppler, and it's showing the vessels filling nicely with blood flow. So the deep or the profunda femoral artery will run deep. So this is a transverse sonographic view, and you can see the femoral artery here, and the deep femoral artery is deeper. It's further away. We've got the probe on the skin. So this is the skin and superficial here, and this is deep. And we've got the vein sitting here, and we know that the NAVY, navy, so we know that that runs lateral to medial. So this would be medial on this patient, and this would be lateral on this patient. I think we've covered the femoral artery. As I said, it used to be called the superficial femoral artery, SFA, but we just call it or refer to it as the femoral artery now. So this is a nice picture which shows that we have the probe sort of on the anterior proximal thigh, and once we head down into the thigh, the femoral artery sits superficial to the femoral vein, so it sits closer to the skin. Once it travels a little, like about this far down into the thigh, it sits deep to this muscle, which we call the sartorius muscle, as you can see here. These muscles run along with a nerve called the saphenous nerve. And so this neurovascular bundle has the femoral artery, femoral vein, and the saphenous nerve. Would have been a lot easier if it was still called the femoral nerve, but anatomy does things to this. It sort of messes with our mind a little bit. So we can follow this femoral artery, which is this more superficial one here. Notice that it sits deep to this line of where the muscles is, which is our deep fascial layer. So it sits deep to that, and it's sort of sitting deep to this sartorius muscle here. So this is in the proximal thigh. You can sort of see the neurovascular bundle here, deep to the sartorius muscle here. And you can see the artery is superficial to the vein and the saphenous nerve. And it travels, as I said, once we get a certain part, a couple of centimetres down into the thigh, in an area that we call the adductor canal. The adductor canal is basically a space between our sartorius muscle. Now, our sartorius muscle travels from our ASIS, our anterior superior iliac spine, all the way down to our medial tibia, and it inserts onto that as part of our pes anserinus complex onto this medial tibia. But between the sartorius and the adductor muscle is an area called the adductor canal, which is exactly where our femoral vessels sit. They travel all the way down to this bottom point here, sort of region where they've finished crossing, and that's the end of the adductor canal. So you can see they always sit medially in the thigh, and look out in the lateral thigh, there's just no vessels in the thigh. Some small little posterior sort of ones, but the major vessels will sit medially. As I said, there's that sartorius muscle. So between our sartorius and our adductor muscle is our adductor canal, and you can see how it sits on the medial aspect of the thigh, and that's where our femoral artery will sit a lot up to about this point, and then it tends to move more posteriorly, and that's sort of the path of the, well, it sort of comes down here, but then it runs through this way. So here you can see our adductor canal, and it's bounded by our sartorius, which if we put the probe on this part of the leg here, this becomes the roof, and then the adductor muscles, which are all of these, mainly our adductor longus, and then our vastus medialis here. And so this is a little adductor canal that transports the femoral vessels. Make sure they're nice and safe because they're fairly important, so keep some muscle bulk around them. And then as it travels more distally down towards the knee, it's going to travel and then become quite deep, because we need it deep to make sure it's safe, and sit posterior to the knee. So once it's come out through that adductor canal, it's going to run down our thigh and then go to our posterior knee. Once it hits our posterior knee in this popliteal fossa, it's called our popliteal artery. So our popliteal artery is this bit. It's a continuation of this femoral artery. Once it's left the adductor canal and it's in the posterior knee, it becomes the popliteal artery. The popliteal artery runs really deep in that popliteal fossa, and it runs along with our popliteal vein and what we call our tibial nerve. This yellow thing is going to be our tibial nerve. Let's have a look. This is a cross-section in the back of our knee. We have our popliteal artery, which is deep and closest to the bone, because remember, sonographically, we'll probably put our probe on back here. And then we've got the popliteal vein that will sit more superficial to it now, which is the other way around from in the thigh. And then we have our tibial nerve, or maybe we might even see a bit of our common peroneal nerve here, which sit more superficial to it. So remember that this is where we put the probe on the back of the knee, and this image we get is the tibial nerve here, our popliteal vein, and then our popliteal artery is nice and deep. I always think that the popliteal artery has to be deep because it's a really important structure for us to compress. So if we peeled open the back of the knee and had a look in, the first thing we'd see would be the tibial nerve because it's more superficial. The next thing we'd see would be the popliteal vein, and then the most deepest structure would be the popliteal artery. So they're just in this little diamond-shaped area of our popliteal fossa here. We often do see our common peroneal nerve. So this is our tibial nerve. It runs in a straight line up and down in the back of the knee. And our common peroneal nerve, remember peroneal, the other word for that is fibula. It runs laterally over to be part of our fibula. So our tibial nerve here, this is lateral and medial, and our common peroneal nerve is going to run over to sit near our fibula. So this is just the same picture, but we can still see tibial nerve and common peroneal nerve. They sort of sit close together before they separate out. But we can still see our popliteal vein is more superficial to our popliteal artery in this transverse sonographic view. We can look in long axis. If we put the probe sort of in this orientation in the back of the knee, and we would see the popliteal vein superficial to the popliteal artery when we looked from the posterior aspect of the knee. I'm going to keep going just so that we can get through these arteries of the thigh, and then we'll stop and then we'll go over the veins. And the veins will be easier because they follow the arteries. I think we've covered this. Here's just a nice picture. I drew it, I coloured it in for you so that you can see this is looking at the back of the knee. Here's our popliteal artery come down. You can see it crosses the knee joint and it keeps continuing down in the back of the knee. Then it finishes when it gives off a vessel called our anterior tibial artery. So our popliteal artery divides into our anterior tibial artery and then that trunk called our tibio-peroneal trunk. So we're down at, this was our popliteal artery. We've given off our anterior tibial artery, which is going to run laterally and then run more anteriorly. So here, this is the fibula, so this is lateral and this is medial. So you can see the anterior tibial arteries running along the back part of the tibia, and then it's going to pop through and go more anteriorly and sort of sit between the tibia and the fibula. And then there's a common trunk called our tibio-peroneal trunk, which will give rise to our posterior tibial artery and our peroneal artery. This is a long axis view. This is towards the head and towards the feet. This is the distal popliteal artery. It gives off this anterior tibial artery, which is this, and then it continues down here as this tibio-peroneal trunk. Then it gives off our anterior tibial artery. So as I showed you, it ran from the popliteal artery laterally around the back, and then it was going to pop anteriorly, and it comes around and it sits between our tibia and our fibula, and it ends up sitting anterior to this interosseous membrane. So this is within what we call the anterior compartment of our leg. So here we can see it sitting alongside the anterior tibial veins, and the veins in the leg are all paired. So we always see one artery and two veins, and then there's a little yellow structure, which is a nerve, which is going to be our deep peroneal nerve. So sonographically, we see an artery and two veins. We can check that those are veins because we push the probe down and apply probe pressure, and the veins compress, and then we can see it sitting anterior to this interosseous membrane here. So we've got probably tibia and fibula here, and this sits anteriorly between the tibia and fibula. So where do we look? We sort of look on the anterolateral aspect here of the leg, and we follow it down this way for our anterior tibial veins. So if you feel the front of your leg, you'll feel your tibia, and then slide laterally to the outside, and there's more fleshy part of your lower leg, and that's where your anterior tibial vessels sit, and that's where we would be putting this probe and sliding it down to get these sort of views. So here's the tibia and the fibula, there's the interosseous membrane, and that's where our anterior tibial vessels will sit. We can follow them down in the calf or the leg, and you can see that they stay between the tibia and the fibula anterior to that interosseous membrane, and then down at the ankle, they'll sit right at the anterior part of the ankle, right in here. And when we can follow it down, and that anterior tibial artery continues along what we call a dorsal or top aspect of our foot. So it comes down this way and it comes through here, and then it becomes what we call our dorsalis pedis. So dorsalis pedis is a funny word. It doesn't have artery after it, but the name dorsalis pedis means that it's the main dorsal artery of the foot. Dorsal meaning that top veiny sort of part of the foot. Let's go back. We're talking about our anterior tibial artery, and then after we've given that off, the artery that continues down here is called our tibio-peroneal trunk, which is just a common trunk before it divides into peroneal arteries, which will run laterally, and more tibial arteries, but they sit more posterior relative to these, so they're posterior tibial arteries. There's only a singular artery in each leg of each of these, whereas there's going to be two veins that travel with all of these. The anterior tibial artery, the peroneal artery, and the posterior tibial artery, you'll have one artery and two veins with all of these. It'll make sense when we cover it in the veins. So your posterior tibial artery, it's going to sit in the posterior compartment of the leg, between the tibia and the fibula, but posterior to this interosseous membrane, and it's sitting over here. It travels with a nerve called our tibial nerve. So these vessels are called posterior tibial arteries and veins, but the nerve is called the tibial nerve. And you'll notice that these are going to be our peroneal vessels. They don't have a nerve. So this is our posterior tibial vessels and our tibial nerve. So you need to think they sit in this posterior deep compartment of the calf, and they're posterior relative to the anterior tibial artery. Where are we going to look at this? We generally look at this if we roll the knee out on its side and we continue to look sonographically along the medial aspect of this calf, so where it sort of feels fleshy. And when we do that, we can sort of see the tibia at the side, and we're going to see our posterior tibial veins, and our artery will sit right in the middle. So it goes vein, vein, and artery just sitting in here. So they're going to be our posterior tibial veins and artery, and our peroneal veins and artery. They sit quite close to each other. We can follow the posterior tibial artery all the way down to our ankle, and it sits on the medial or inside part of our ankle, and it runs under a little roof sort of structure called our flexor retinaculum in our tarsal tunnel, and so that's where our posterior tibial artery will sit. So that's this artery here. And then the other artery is this peroneal artery. So remember, peroneal is a word that means fibula. So it runs right next to the fibula, and in fact it runs medial to the fibula. So that's our fibular artery. If that's easier to remember, you can always use the term fibula rather than peroneal. There is nothing anatomically wrong with using that term. Remember though that it does not run with a nerve. It runs with peroneal veins, 2 peroneal veins, but no nerve. And it still sits in this deep posterior compartment. So usually we look with the leg positioned in the same position, and we look at our posterior tibial and peroneal arteries at the same time because they're sort of close to one another. The difference being is that the posterior tibials run with a nerve, the peroneals don't. And then it sort of comes down to the ankle. We sort of can see our anterior tibial and our posterior tibial vessels. Our peroneals sort of peter out by the time we get to our ankle. I'm going to leave it there. That was our lower limb arteries as we would follow them sonographically. It's really important that you can understand that progression of those arteries. They're really important that we understand them. We have to follow them sonographically, and all sorts of problems can go wrong with these. If there's a blockage to flow in these arteries and they get too calcified or anything, particularly if all of them are blocked, that's not, good because the leg's not receiving any oxygen. And some people, if they get this peripheral arterial disease and it affects all of these arteries, may not be able to keep their lower limb, and that can happen with people that have really bad diabetes or vascular disorders. And so we do a lot of ultrasounds to look for that. I'll leave it here. I hope that that's unpacked the arteries of the lower limb. The next lecture I'll come back and I'll do the veins, and the veins will be like revision because it's following the same sort of veins. The veins will just come the other direction, but we tend to follow them from proximal to distal, but you do need to know them, and that's the deep veins, and then we'll have a separate little presentation just on the superficial veins. I'll leave it there. I hope your head's not hurting too much. Bye.